For early stage prostate cancer, when the cancer is only limited to the prostate, when the cancer hasn't already spread, then theoretically by taking out the whole prostate, it should give you a cure if it had not gotten out of the prostate. So radical prostatectomy just means taking out the whole prostate. Well, traditionally prostate surgery for prostate cancer is actually a big incision from the belly button to the pubic bone area. So it's a big long incision. You go in there, basically open the bladder, take out the whole prostate, and then you have to connect the bladder back to the urethra, and it often open where you get cut open for the procedure. There's a newer way of doing it, actually becoming the most common way of taking out prostate for prostate cancer now is with the robot. And it's actually a laparoscopic procedure. We make small puncture holes in the abdomen, and we use a advanced instrument, which is a robotic instrument, very, very small instrument that go in there and able to do the same surgery that open surgery will accomplish, and do it laparoscopically. So it's much smaller incisions, quicker recovery, much less blood loss, shorter hospital stay, and the usual benefits that applies for minimally invasive procedure, laparoscopic procedure applies for this type of surgery. So generally, it's a better way to go. There are a few things we know for sure. For example, much less pain because you don't get a big cut, you get smaller openings. Much less bleeding because when we do the procedure, we pressurize the abdomen and it stops all those veins from bleeding. So transfusion rate from the surgery is much less. And the other thing we know for sure is that shorter hospital stay. When you have less pain, quicker recovery, you're able to go home sooner. And the other thing we know is that the catheter can stay much short amount of time. With the open surgery, it can sometimes stay for 2 weeks and sometimes even longer. But with the robotic surgery, we typically leave that for about a week or so. So the amount of time the catheter needs to stay in there for it to heal is shorter because healing happens faster. These are all kind of established, we know for sure. And there are other things that we know that probably helps is that because you can see better, so it perhaps can save the nerves better, so help with lowering the side effect that can happen with surgery with the incontinence and the erectile dysfunctions. And whether or not the cancer can be better controlled, they actually should be the similar type of surgery of the open surgery, so it's very similar in terms of how it's taken out. So in terms of benefit and getting rid of cancer should be very comparable to the open surgery. Yes, so this all surgery actually these days we do, it doesn't matter if it's open or with the robot, it's called nerve-sparing radical prostatectomy. In the old days, back when we actually understand anatomy, the prostate is taken out with the nerves around it. The nerves would give people erections. So now we know what the nerves are, we're actually able to separate the nerve from the prostate. And theoretically, with the robotic surgery, you can have a much better visualization, so you can see those nerves hopefully better, and able to peel them off the prostate and save those nerves. That hopefully the erections after surgery can be preserved. Now, it's not uncommon after surgery that erections will not work as well for a little while. And in fact, people have erectile dysfunction for the first year to 2 years after surgery. It's not uncommon because those nerve endings, they're kind of finicky. They don't like to be pulled around and stretched. Even by pulling them away from the prostate, they get beat up. They don't work for a while. So it takes about 1 year to 2 years for it to come back. There has been studies that show that sparing the nerves can help the urine control as well. As you know, the urine control is one of the issues that can happen with surgery because you will actually rearranging the urinary tract, so to speak. And it is possible to have incontinence after surgery. Fortunately, most people with the robotic surgery, for example, by about a year's time, the urine control comes back close to what they had before. We also believe that by saving those nerves frequently can help with the urine control as well. But it does take time to get back to normal. It frequently takes about a year. Most people are gonna be wearing a pad or diaper in the first few months. And it takes about a year for it to get back to close to normal. But fortunately, with the robotic surgery, 95% of people by about a year's time, they're pretty good. If you ask them, they're pretty happy with their urine control. But 5% can have long-term urine control issues, even beyond the 1 year recovery time. But I usually tell patients to be patient. It does take sometimes 6 months to a year for the urine control to come back. Now, people that are younger, people that have a no baseline trouble with the urine to begin with, or smaller prostate, no diabetes, not overweight, those people tend to do better in general too. So those people might have a quicker recovery and better chance of recovering also.